Would you use ChatGPT as your therapist? AI therapy is on the rise.
AI therapies.
Everybody is using ChatGPT as their therapist.
But is this a good idea? Is it as effective as human therapy? Or does it make things even worse? In this video, we'll dive into the latest science, and I'll try AI therapy myself. Can you be my therapist?
I'm here to listen and support you in definitely be signs that align with ADHD.
Now, before we start, let me just say that if you clicked on this video because you or someone you know is struggling, there are effective treatments and professional help available. Reaching out to a therapist or a hotline can make a huge difference. Now, why are people doing this? Well, the demand for therapy has exploded over the last years and decades. I mean, the reasons for that are a whole new topic, but most importantly, the supply hasn't matched this growth at all. Finding a therapy spot can almost feel like winning the lottery in some places, with some spending months on waiting lists. And this situation is a problem in most countries. So, seen from this angle, AI therapy could revolutionize this. Because it's available in every region 24/7, no waiting lists, not just once a week, always if you feel like you need support. Also at a much lower cost, not only for the patient, as well as the whole healthcare system. Also, using AI has a lower barrier of entry in terms of anonymity and stigma, essentially because it's not human. Of course, this is also a major downside, as we'll see later, but when starting a therapy and opening up, this can really be an advantage. So, it sounds great, right? Well, before I test it myself, let's look at the science. Is it really effective? Well, surprisingly, yes, but also not always, not for everyone, and not for everything. Over the past few years, researchers have been running dozens of studies and randomized controlled trials on therapy chatbots, and more recently on LLM-based systems like ChatGPT-4. And the pattern they're seeing is pretty consistent. For mild to moderate symptoms of anxiety, stress, and depression, AI-based interventions can meaningfully reduce symptoms. In some trials, the effect is actually comparable to established low-intensity treatments or guided online programs. A study from Dartmouth tested an AI chatbot called Therabot, which was developed by clinical researchers specifically for therapy, particularly cognitive behavioral therapy. In a randomized controlled trial, they found an average reduction of 51% in symptoms for depression and 31% for anxiety. These numbers are very impressive and comparable to normal therapy. Yet it's also worth mentioning that this study was done by some of the same researchers that were involved in creating the chatbot. Generally, early meta-analyses suggest more modest overall effects. They report effect sizes of about 0.2 to 0.3, which is definitely better than 0, yet smaller than the effect sizes of traditional psychotherapy with 0.8 to 1. But, for comparison, the average effect size of antidepressants is 0.3, depending on the severity and generally higher for severe cases, but still comparable. The main drawback of AI is that it's not human. Well, duh, but this is important because it lacks real empathy. Across all methods and schools of thought in psychotherapy, the therapeutic relationship is considered the most important mechanism of change in every therapy. But with AI, there is no real relationship. It doesn't pick up subtle cues like the tone of voice or facial expressions, and it's just not human. Of course, on an informational level, it can give you explanations, plans, or exercises, yet it cannot build a genuine relationship. Some studies also suggest that LLMs may harbor biases. For example, a Stanford's team of researchers found that chatbots were more negative towards conditions like alcoholism or schizophrenia, which could reinforce stigma. On the other hand, they tend to be too validating, which for some conditions, like borderline or narcissism, for example, isn't ideal. The availability can also become problematic, in some cases mirroring addiction-like behavior. I mean, psychiatrists agree that therapy should have clear boundaries. For example, the therapist is not supposed to be your friend. It is only limited to the sessions. I mean, they don't give you their private phone number. And in general, therapy is only designed for a limited period of time, with the idea that afterwards you can hopefully master challenges yourself. So becoming too reliant on a therapist is, in most cases, not good. All studies agree that it can help with mild to medium symptoms, but more severe symptoms or certain thoughts or urgent crises should always be handled by human professionals. So where does this leave us? Some researchers see AI therapy as a Tier 0 or Tier 1 intervention, basically the first step in a stepped care model. Something that can help millions of people who would otherwise get no support at all. But one thing is clear, AI therapy isn't replacing human therapists, but is becoming part of the mental health ecosystem. And that's why the next question is crucial. What does using AI as a therapist actually feel like? Alright, so I've got ChatGPT on my phone. And well, let's see how he performs as a therapist. So now I'll be telling him some symptoms that I experience. I've decided to go with ADHD, which probably many people self-diagnose or diagnose via ChatGPT. Can you be my therapist?
I'm here to listen and support you as best as I can, and I can definitely help with guidance or resources. Just keep in mind, I'm not a licensed therapist, but I'm more than happy to chat and help out in any way I can. Let me know what's on your mind.
I'd say in general I have difficulty focusing.
Well, there are a few strategies we can explore. For example, setting up small, manageable goals using techniques like the Pomodoro method, or even minimizing distractions by creating a dedicated workspace. We can also look into some time management tools or even mindfulness practices to help improve focus. Let me know if any of those sound like they could be helpful and we can dive deeper.
What do you think could be the cause of that?
There can be a bunch of different factors. It could be things like stress or anxiety, maybe sleep issues. It might also be influenced by how we use technology and how often we multitask. It could be a mix of things, and exploring them together might give us some clarity.
Yeah, I mean, could it be ADHD? Like, I feel like I've had this my whole life.
Can definitely be signs that align with ADHD, and it's not uncommon for it to persist into adulthood in different forms. If you're curious, it could be helpful to look into a professional assessment, or even just explore some targeted strategies that can help with focus and organization.
Okay, if I want to do a therapy, what would you recommend?
If you're considering therapy, cognitive behavioral therapy, CBT, is often really effective for managing ADHD-related challenges.
So I think this little test showed that ChatGPT could be a good starting point if you have like certain symptoms and don't know what you could do, or if there are any therapy options for that. Also, I think it's good that for a proper diagnosis, he always referred to a professional. But it's also clear that he doesn't really act like a therapist would. Maybe with a more dedicated prompt in the beginning, you could get him to. But still, he doesn't have a therapeutic plan or strategy, because, well, it's designed to be an assistant and quickly give you information and solutions. AI therapy isn't a miracle cure, but it's also far from useless. The evidence shows that for mild to moderate symptoms, it can genuinely help. But for severe conditions, however, it can't replace the depth, nuance and human connection of real therapy. So the real power of AI may lie not in replacing therapists, but in expanding access to support for the millions who currently receive none.